And here's some good news. COVID cases are way down in West Texas. Last month, we saw a 30 to 40% positivity rate. Now we're between 5 and 10%. We've been hearing talk of a possible fourth booster shot for the fall, but with declining numbers, do we really need it? News West 9's Francisco Soto spoke to local doctors about the decline in cases and what you should know about the possibility of a fourth COVID vaccine.
It's like deja vu, COVID numbers declining once again.
We've always followed since the beginning of the pandemic is about 2 weeks of no new cases in our community. We haven't quite hit that yet, but we're getting closer to hitting that. At that point, we can say the disease is gone. We haven't really been there for a while now. But last year, if you remember, after our first couple of surges, there was a period of time for about a month and a half where we had no new cases.
The decline in cases sparking the CDC to outline new mask guidelines for most of the United States.
In those places, they don't recommend that you need to wear a mask indoors, especially if you're vaccinated. So really 3 levels is what we're looking at from a community level standpoint: low risk, medium risk, and high risk.
Infection preventionist Val Sparks at MMH says that the CDC is not recommending a fourth dose of the COVID vaccine yet, except for a very limited group of people with severe underlying conditions.
Only individuals that are recommended to get a fourth dose, and it's very prescriptive. It's those that are actively receiving cancer treatment for tumors or blood cancers, or if there is a physician order where with multiple underlying conditions, high-risk conditions, and being moderately or severely immunocompromised.
However, doctors continue to encourage people to get vaccinated with either the first 2 doses of the vaccine or the booster or third COVID vaccine dose.
5 to 6 months has passed from when you got fully vaccinated. The booster is still recommended for those because it is providing you protection, continued protection against severe disease, even if it is to come up again.
Francisco Soto, News West 9.